Zubair pharmacist.
Your own pharmacist.
An ability of an organism or the body to recognize, neutralize, or destroy the invading foreign organisms or particles is known as immunity. Immunity is of two types. 1. Innate immunity. 2. Acquired immunity. 1. Innate immunity. The nonspecific immunity governed by the body's own defense system, for example skin and cells, is innate immunity. 2. Acquired immunity. It is a type of immunity that an organism or the body builds up with the passage of time. It is caused either by infection, vaccination, or injecting antibody from another person. Active and passive immunity are two subtypes of acquired immunity. Active immunity can be natural and artificial. When the immunity develops in response to a disease or invading microbes is natural active immunity, while immunity gained after receiving a vaccination is termed as artificial active immunity. Thus, body cells build their own antibodies in response to pathogenic microbes or attenuated ones. Passive immunity is when the body receives ready-made antibodies from the mother as natural passive immunity, while immunity gained after receiving ready-made antibodies in the form of drug or medicine is artificial passive immunity. Antibodies are glycoproteins, termed as immunoglobulins, secreted by the immune system mainly by plasma cells in response to invading microorganisms. There are several types of antibodies, namely immunoglobulin A, immunoglobulin D, immunoglobulin E, immunoglobulin G, and immunoglobulin M. A body under pathological condition may secrete antibodies against its own cell and organs, and condition is termed as an autoimmune disorder. COVID-19 has affected 13.2 million people worldwide. Clinical trials are being conducted worldwide to discover new treatment and preventative regime. For proper immunity, there is a need for artificial active or passive immunity, vaccination or synthetic antibodies. Like other diseases, the defense system of COVID-19 patients also secretes antibodies against coronavirus. Ling et al. 2020, published in Immunity Journal, suggest an increase in immunoglobulin G and M along with interferon gamma. After the evidence of antibodies against COVID-19, an intervention called plasma therapy started. In plasma therapy, antibodies from the recovered COVID-19 patients are withdrawn with plasma and injected to the diseased patients. There are many limitations for this therapy. Plasma contains many antibodies which donor's body has generated against several ailments or organisms, etc. Thus, synthetic antibodies can be used to couple this problem. A clinical trial of a combination of two synthetic antibodies, REG-CoV-2, has been started. Phase 2 and 3 trials comprising more than 4,000 unaffected individuals take place at 150 sites in the US, Brazil, Mexico, and Chile. The two antibodies cocktail binds to the viral spike proteins and neutralize them.